Question 11. The risk of developing high blood pressure can be reduced by reducing salt intake. Yes, it's true, right? The patients that are suffering from high blood pressure, then we reduce salt intake. We advise them not to, even those that are smoking, we advise them also not to stop, they should stop smoking. See, taking regular physical activities. True, because regular physical activities will remove sweat, and you and I know that sweat is made of water and salt, so it's salty. So all those answers are correct. Which of the following is untrue of Helicobacter pylori? Helicobacter is a normal floral bacteria, right, found at the pylorus of the stomach. A, causes chronic gastritis. B, gram-negative bacteria, gram-negative bacillus. C, undetected before a peptic ulcer is formed, has a flagellum for motility, which is untrue. It's not true, right? Because even if you collect specimen from the pylorus of the stomach before a peptic ulcer, you can see, since it's a normal flora bacteria, right, found in the small intestine, found in the stomach. Sorry. Which of the following is false regarding the drug cimetidine? Cimetidine is Cimetidine falls under which class of drugs? That's the funniest thing you need to understand. Cimetidine is an H2 receptor blocker, right? H2 receptor antagonist. What does it do? It prevents the secretion of acid in the body. It prevents the secretion of hydrochloric acid, right? It's a competitive antagonist that inhibits basal acid secretion. That's true. It is effectively decreases acid secretion in response to histamine, gastrin, and that's very, very true. It inhibits CY enzyme, causing drug-drug interaction with D, more effective if administered before secretion of acid. Now, the two answers that we have there that may be untrue is this is C and D. Now, what then is the interaction between cimetidine and warfarin? Because this is warfarin and TCA. He said it causes drug-drug interaction with warfarin and that, and then D is a more effective if administered before secretion of acid. We will come back to that question. I will not answer the question now. I will come back to question 13. Please, when you listen, please remind me. We'll come back to it so that I'll explain some few things. Which drug is given to counteract the effect of non-steroidal anti-inflammatory drug? That's that in the treatment of causes of peptic ulcer. Which drug? Amoxicillin to counteract the effect of non-steroidal anti-inflammatory drugs. That's clarithromycin, misoprostol, none of the above. Misoprostol is the right medication, right? Because it helps to build, it provokes, it increases the growth of prostaglandins in the walls or the mucosal linings of the stomach. Hence, it prevents the action of non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, their main one of their purposes is that they have more of acid in them, right? Most of the time, the carboxylic acid which sums up in effect with hydrochloric acid, and then to erode the walls of the stomach. Now, when you take it in combination with misoprostol, it reduces the effect, right? It prevents that. Anemia, question 15. Anemia can be caused by insufficient dash in the body, insufficient iron, right? Because we have A, iodine, B, iron, C, calcium, D, sodium. Is iron, right? Which of the following form of drug is administered directly into the respiratory system? Suppository are medication that are inserted via the anus. B, aerosol or spray. That's an example. It's true. Ovuse through the vagina. D, ointment, topical ointment, right? So B is the right answer to that question, directly into the system. Which of the following factors affect the pharmacokinetics of drugs? What is pharmacokinetics? What the body does to the drug, right? Right, that's digestion, absorption, assimilation, and all of that. So age, genetics, disease, right? Age affects people, older persons, older persons. It takes long for the medication to digest before going to the stomach and all of that. Then genetically, there are some particular genetic traits that are against particular medications. That's true, right? And then the disease condition too. So all of the above is correct. Question 17. Which of the following is not a parenteral route of drug administration? Parenteral route is injectable route of drug administration. We have seen intradermal. That's a sublingual. That's true because it's not it is not a parenteral route. B, intradermal. C, intramuscular. All of the above. You start A is the right answer, right? A, sublingual, because you are under the tongue, right? Drug toxicity refers to how poisonous or harmful a substance can be. In which of the following condition can there be drug toxicity? A, toxicity, right? When a drug accumulates in the body, or a drug, yeah, like for an example, Bactrim is toxic to the kidneys in that it causes kidney stone. It goes and accumulate in the kidneys. Now let's look at the answers that have been given to us. You said drug toxicity refers to how poisonous or harmful a substance can be. In which of the following conditions can there be drug toxicity? When a person has accumulated too much of the drug in his bloodstream, leading to adverse effect of the body. That's true, right? That's very, very true. Like even in the case of an overdose, right? B, when the dose given is too much, too high, that's overdose, right? It can lead to toxic effect. The liver or the kidneys are unable to remove the drug from bloodstream. That's true. So question, that's D, all of the above. So question 19, all of the above is correct. When organs are affected by high blood pressure, what organs are affected by high blood pressure? What organs are affected by high blood pressure? You see, we have A, we have the eyes, B, we have the stomach, C, we have the heart, D, we have the kidneys. You see that what organs are affected? The eyes, the heart, and the kidneys. Those are the three organs. You see that question has three true answers, right? How are the eyes affected? Because when there is reduction of blood flow because of organ failure, because of peripheral blood resistance, because of reduction in the lumen of the blood vessel, because of the action of angiotensin 2, which increases peripheral resistance, there is reduced blood flow to the various organs of the body, hence organ failure, hence the blood vessels of the eyes are not well perfused with blood. So that's it. So how do non-steroidal anti-inflammatory drug causes peptic ulcer? How do they cause peptic ulcer? They cause increased mucus production in the GIT. No, it's not misoprostol that does that. Misoprostol increases mucus production in the GIT, especially in the stomach. B, causes decreased prostaglandin by inhibiting coenzyme. C, causes overproduction of acid in the stomach. D, none of the above. You see, question 21 has two answers that are correct. B and C, causes overproduction of acid in the stomach. That is one of the causes. That's one of the things that it happens with question 21, right? You know that two answers are correct, right? Two answers are correct. Causes reduction or decrease in the prostaglandin in the body, and increase also causes product increase. So now the preferred answer that you can give there is prostaglandins, right? Causes decrease in the production of prostaglandin in the body. That's right. Question 22. Where is the most common location of peptic ulcer? Where is the most common location for a peptic ulcer to develop? We answered this question yesterday, right? It can develop in the duodenum. Since we have the small intestine divided into three parts, the duodenum, the ileum, and the jejunum, right? So the first part is always the duodenum, right? That's peptic, that's duodenal ulcer. Question 23. Which of the following medication is most appropriate for the management of preeclampsia? Preeclampsia. calcium, magnesium sulfate, calcium sulfate, sodium sulfate, iron sulfate. Now, preeclampsia, that's right. Preeclampsia, persistent increase in the protein level of a pregnant woman and high blood pressure, right? When urine analysis is done, you still find protein in the urine of a pregnant woman, accompanied with edema, pitting edema. The best drug that we use is magnesium sulfate. Magnesium sulfate is the best preferred drug. Calcium sulfate cannot go, sodium sulfate cannot go, and even iron sulfate cannot go. Aplastic anemia results when A. There is deficiency in vitamin B. B. Bone marrow does not make enough blood cells. C. Red blood cells have a sickle shape. D. There is deficiency of folic acid. Right. B. Bone marrow does not make enough red blood cells. That's the right answer to that question, because that's how aplastic anemia comes about. That's how aplastic anemia is brought about. The most common type of hernia occurring in children. Question is repeating itself. Our question has repeated itself. Umbilical cord, you see, just get your immediately as you fail the other question one or the other part, you also fail this one. You are a nursing, you are nursing several patients in a medical ward, some with stroke, unconscious patients, and others with different conditions. What is the first thing to do to prevent the occurrence of pressure sores among the patients? What is the first thing to do to prevent pressure sores? That's bed sores. A. Frequent changing of patient's position. B. Massaging patients. C. Identifying those patients who are susceptible to having pressure sores. D. Educating the patient's relative on the prevention of sores. To me, they said you are the only person with many patients that you are taking care of. Because for you to be treating a patient often, it means that that's what you'll be doing. You will not even be able to administer drugs or take care of new patients that may be coming in. So what you will do is that you identify those patients, new patients that may be susceptible to having pressure sores, and then try to be changing. Like among them, you go to those who are susceptible, who are liable, like older persons whose skin texture is somehow right. You try to be changing them often so that you may not so that they may not develop pressure sores. Or to an extent, you can also educate the patient's relative too, if the patient's relative are there, to also do the same. So these two questions, these two answers, C and D, are correct.